Welcome, everybody. I'm Molly Brown from the Heartland Telehealth Resource Center. We're glad you're joining us today for the HTRC Education Series focused on telehealth billing, coding, and policy. Just a few notes and reminders. This session is being recorded, and we'll share it with you afterwards, along with any relevant materials or any resources that Rochelle may refer to. Your microphones have been muted. If you would like to ask a question, you can use the chat box or raise your hand, and we do allow for some time at the end. Your completion certificates will be emailed shortly after the webinar. It's important to sign on with your first and last name so we can identify you. Please rename yourself by using the 3 dots on your Zoom screen if your full name isn't available. So let's get started. Rochelle is a local attorney who is also a registered health information administrator and certified medical coder. Her practice focuses on medical billing, coding, and reimbursements, HIPAA privacy and security, health information management, regulatory compliance, and most recently, public health emergency. We're thrilled to have Rochelle with us today to talk about reimbursement resources to support telehealth programs. Now I will turn it over to Rochelle.
Hey, thank you, Molly. So we've been talking a lot the last year or two about a lot of different sources of information, from statutes and regulations to payer policies. And as Molly and I were discussing the sessions that we've done, we realized we really haven't done a walkthrough of where to find all of these resources that we talk about in our different sessions. So that's what we wanted to do today, is do sort of a hands-on showing you these different statutes, regulations, manuals, and guidance resources that you all can refer to and find the latest and greatest information on telehealth. Now, this is no longer maybe late breaking news. Many of you have heard that the Secretary of the Federal Department of Health and Human Services announced that they would be, or that they plan, knock on wood, to allow the current cycle, the current 90-day cycle of the federal public health emergency for COVID-19 to expire. They would allow it would sunset, or it would expire at the end of the day on May 11th, making May 12th, 2023 our first post-public health emergency day. And with that will come a lot of changes, and we've talked about a few of those in previous sessions. Some things that will go away the day the public health emergency ends, some things that will go away maybe 151 days, likely through December 31st of 2024, based on kind of a current discrepancy between Medicare policy and federal law, and certain flexibilities with respect to telehealth that would continue to be available through December 31st of 2023. So I've got a link to that if you want to refer to the Secretary's announcement. In the meantime, I want to talk through some of the different resources, and I'm going to now kind of shift away from my slides and just go right out to my internet browser for you all to follow along and talk through some of these resources. Our rules for telehealth, particularly with the Medicare program, starting with Medicare, starting at the federal level, really come from the Social Security Act. And so I've got the link in my URL. You're going to have the full URL and a hyperlink in the slides that we send out. But it's section 1834, and I've already scrolled down to the section that talks about payment for telehealth services. Now, this is important because this tells us what pieces of those telehealth rules that had been in place prior to the public health emergency are set by Congress. If there is any rule that is here in the Social Security Act, Medicare, CMS, the Federal Department of Health and Human Services can't change that through regulation and rulemaking. They have to follow what Congress directs here in the Social Security Act. In particular, if we come down to originating sites, this lists the eligible originating sites. Is kind of complicated, but the sites referred to in clause 4C little Roman numeral I, if you can follow along right here, when it's talking about what an originating site is, listing those out. What you do not see here in the Social Security Act, with very, very limited exception, is the home of the individual. So once we get past these post PHE kind of periods, the home of the individual may no longer be an eligible originating site. Now, I say this, but there has since been legislation to add some exceptions to the end of this section 1834. And let's see if they've incorporated onto this website yet, that extends the home as an eligible originating site through December 31st of 2024. So that's not policy and rulemaking by Medicare. That was Congress saying at least through December 31st of 2024, the home will continue to be an eligible originating site. So that's where we're getting all of these basic terms and definitions. This is the origin, or this is the source document. Sorry, I'm going to scroll back up here just a bit. That establishes, or typically for telehealth to Medicare, that it has to be in a rural geographic area, defining what a rural geographic area is, or a healthcare provider shortage area, defining what a healthcare provider shortage area is. All of those restrictions that we had prior to the PHE really come from the Social Security Act. After the Social Security Act says, Congress says we will pay for telehealth services under these certain restrictions or conditions, typically, if we ignore the PHE, then the Department of Health and Human Services, CMS, can create regulations to interpret and kind of lay out how they will cover different telehealth services. For example, if I'm looking at the telehealth regs, I'm just going to do a word search in here for telecommunications system. Okay. So the secretary will pay for telehealth services furnished via telecommunications system. Let's see. And then for Alaska and Hawaii, that includes store and forward, but not everybody else. What Congress does not do is define telecommunications system. That's left to the Department of Health and Human Services to decide. So that's where rulemaking of the Department of Health and Human Services come into play. So now I'm going to switch gears and we're going to look at the regulations that HHS at the federal level has promulgated to say this is how we are going to implement and pay for telehealth services. Now, the regulation itself, the primary regulation that we'd refer to, is 42 CFR 41078. And I'm not going to read through all of this, but you can see this is where HHS defines what they consider to be an interactive telecommunications system. And we know typically outside of some of the flexibilities from the public health emergency, that generally means live, two-way, real-time audio and visual communications technology, kind of like we have going now. You can see me, you all could interact, you can hear me, you could ask questions, that type of interactive telecommunications technology. There may be some exceptions. There may be for audio only type services that we've talked about in different sessions as well. But this really goes into detail on how HHS defines these different types of technologies, originating site, a lot of those terms that we saw in the Social Security Act. This is the resulting regulation, but I'm going to scroll down to the bottom of this regulation, and you're going to see a bunch of text and paragraphs here. These were the rule-making documents where Health and Human Services says, public, here's what we're thinking about implementing regulations to put into effect Congress's direction that we cover telehealth services. And you can see there's quite a lot. Every one of these blue hyperlinks is a different piece of rulemaking. And that proposed rule that Health and Human Services publishes tells the public what they're thinking of doing. And then there's a comment period. And then there is a final rule, which could change the language in the regulation that we're looking at. So I want to look at just one of these Federal Register documents. I've got that on my next tab here, that talks about telehealth services. And these are so valuable. I am in the Federal Register documents all the time because there's so much information in the Federal Register that never makes its way to the text of the regulation itself. For example, when Health and Human Services publishes a proposed rule and outlines what they think, how they think they're going to define interactive telecommunications system, how they think they will define eligible practitioners, and so on. And then we have public comments, and the final rule is then released in response to public comments. What you will find in the Federal Register, I'm going to skim down here so you can see an example of it, is Health and Human Services taking comments from the public that they think are important and responding to them, answering them, and addressing them. And a lot of this that is extremely valuable information about HHS's policy does not make its way into the final regulatory text, but it tells us how HHS will interpret its own regulations and its own rules and requirements. So I think that's just incredibly helpful to keep an eye on those Federal Register documents. And again, you may have to dig through a lot of historical Federal Register documents, which reflect the evolution of rulemaking to get to the place where we are today with this 42 CFR 41078 regulation. Now, there's another type of, going back to the slides here, we've looked at the Federal Register. One particular Federal Register publication that you may be familiar with is the annual physician fee schedule that Medicare releases. So I'm on CMS's website, and I'll show you how I navigated to this page where we can find the final rule as well as a lot of attachments that tell us a lot of information about telehealth in the current year. So I start by going to cms.gov. I click on the Medicare tab, and I scroll down to the provider type. Even though it says physicians here, this is really professional billing. So if I click on physicians, and I click on the physician fee schedule, and I go to federal regulation notices, you can pull those. I'm jumping around on you. You can pull a lot of these Federal Register publications right from here based on the year. So if you want to know what was the rule last year for direct supervision of telehealth services, you could pull up the final rule, the F stands for final, for calendar year 2022. If you want to see what was proposed compared to what was finalized, you can pull up the proposed rule for 2022. The P stands for proposed and the F is final. I'm going to click on the final rule for 2023. And this page gives us, look at all of these attachments and exhibits of information that goes along with what we find in the Federal Register. The Federal Register itself is here, and I can click on that to open up the text of the Federal Register, where I can search for telehealth, or I can search for direct supervision and some of those key terms to read what Medicare said this year about what might be changing. I could read Medicare's explanation on any new services that will be covered as telehealth that maybe were not covered in previous years, or services that were proposed to be added to the telehealth list that were not added, and why Medicare decided not to add those services to the list of covered telehealth services. As you can see, it takes a while to load this document. It's often several thousand pages of information covering both telehealth and everything else that's changing for the current, the current calendar year. So while that loads, I'll go back to our main screen for the Medicare physician fee schedule for 2023. And there's another really important and helpful document in here specific to telehealth, and it's the list of telehealth services. This tells you each year services that have been added to the list of covered telehealth services for the Medicare program, and it will include that list here. I'll show you what that looks like. This is the Excel spreadsheet, and it will show you the codes that are covered as telehealth services, a short description. Now, I actually pulled up the 2022 list because the 2023 list, for some reason, does not include this, I think, very helpful information that we need to know right now as the public health emergency is winding down. Last year, Medicare gave us some really helpful information, like this code 0362T is a temporary addition on the telehealth list, meaning it won't be here forever once the PHE goes away. It will go away, I believe it's December 31st of 2023, the end of the calendar year when the PHE ends. That would go away as a temporary telehealth list. It tells us for certain CPT codes, could that particular service be rendered in an audio only format right now during the public health emergency? Because remember, the regulation normally outside of the PHE defines interactive communication systems as audio, visual, live, two-way real-time communications. So this is a temporary flexibility for certain services that could be rendered as audio only right now during the PHE. But this is a great spreadsheet to refer to if you're on this website each year to look and see. It's a quick way to see what telehealth services have been added to the list. You could also come to the Federal Register and do a keyword search for telehealth, but I'll let this kind of run up and you can see there are a lot of entries, a lot of hits with the word telehealth. It's mentioned 421 times in this document. So if you wanted to see what happened in 2023 with telehealth, you're going to be spending a while. Oh, it's still going, 580. You're going to be spending a while going through each of the instances of the word telehealth in this document to understand what has changed. You can navigate this for each year. You can go back and look and see what telehealth services were covered in 2020 or in prior years. Can't remember how far back this goes, but into the early 2000s, you can find that list of covered telehealth services. Now I'm on a different page of the CMS website, and you'll have a link to this in your materials as well, but this is just sort of a telehealth homepage, if you will, for CMS, giving you links to a lot of different locations. The physician fee schedule, that's what we were just looking at. HRSA's Medicare Telehealth Payment Eligibility Analyzer, which is where you can go in and enter your geographic location, like by zip code, and it will tell you if you fall into a rural geographic area, the way Medicare defines rural for telehealth coverage outside of the PHE, or a healthcare provider shortage area, the way that's defined outside of the PHE. This is also where you would go to submit a request that Medicare consider adding certain services to the list of covered telehealth services, that spreadsheet that we were just looking at. So you can submit a request here. There's a request for addition that gives you, let's see, I think it tells us the date somewhere in here. It's February 10th, I believe. Tells you how to request that addition. and the criteria. This is extremely helpful if you are submitting a request. And again, by February 10th, we're past that deadline for this year to be considered as an addition for next year. But if you wanted to be doing that in the upcoming year for consideration in 2025, look at the criteria that causes a service to be potentially covered as telehealth, and explain in your request exactly how that code or that service meets either category 1 and or category 2 criteria. Every year when I'm reading the Medicare proposed and final physician fee schedule, Medicare says they received requests without any additional information. It just says we want you to cover physical therapy as a telehealth service. And it doesn't explain, the request didn't explain how that service meets category 1 or category 2 criteria. So don't leave that up to Medicare to guess if you want to submit that request. I'm going to switch over to another Medicare. This is still looking at the federal level, another Medicare telehealth resource. Now, this one is focused on policy changes related to telehealth during the public health emergency. And CMS and HHS have been working on putting together a sort of roadmap to help providers with the wind down after the public health emergency ends, effective May 12th of this year. And so what you'll see on this page, and this is the questions that I'm getting most often for telehealth right now, are what goes away May 12th? What flexibilities will go away? What flexibilities will continue for 151 days after the PHE ends, or through the end of this calendar year, or through December 31st of 2024? This page is Health and Human Services starting to compile certain flexibilities that were made permanent, certain flexibilities that are temporary through December 31st of 24, through the end of the PHE, et cetera. So I think this is just a really helpful guide to help you navigate when some of those changes will be going away. For example, a permanent change for FQHCs and RHCs is that they will be eligible to serve as distant site telehealth providers specific to mental and behavioral health care services on a permanent basis. Now, outside of those mental and behavioral telehealth services, their ability to act as a distant site telehealth provider at this time would go away December 31st of 2024. So you have to be aware of some of those caveats and nuances too. So that's sort of an orientation to some of the key resources that I am visiting all the time when it comes to looking at telehealth changes and policy, and now the PHE wind down. And I want to shift gears a little bit and start to look at some of the state-specific resources that you all can refer to throughout Kansas and Missouri and Oklahoma. One of the first places I always go outside of just kind of my legal research tools, but as a place to get a general orientation on different topics in different states, is the Center for Connected Health Policy. They have, as you can see, topics all over the place for telehealth. You could toggle to federal rules and requirements for the Medicare program or general Medicaid requirements. I often use it for state-specific requirements as well. So if I toggle to the state of Kansas, they have broken down telehealth concepts by several key topics. Changes in the state of Kansas that are specific to the COVID-19 public health emergency, or the state's version of that, the state emergency declaration, which has expired in all three of our states, Kansas and Missouri and Oklahoma. But these links send you to Medicaid resources specific to the state of Kansas, different policies, different provider bulletins. So I think that's an incredibly helpful resource. Oh, I meant to go back to my main page here. Yes.
Michelle, I got a
Yes.
question directed to me. So the question is, does the federal register pertain to Medicare, Medicaid fully insured employer-sponsored plans, and self-funded employer-sponsored plans. So for example, the list of covered telehealth codes approved on the fee schedule states list of Medicare telehealth services effective January 1st, 2023, updated November 1st, 2023, I'm guessing. Or
Yes. Okay.
2022.
So it's a great question. And let me try to restate it and make sure I'm capturing it correctly. What I think they're asking is what's in the Federal Register that will translate into federal regulations and a list of covered telehealth services and when and how they're covered. What does that apply to? That Federal Register document that we were looking at is part of the Medicare program. So they were asking about fully insured or self-insured plans that may be covered under federal ERISA health plan benefit rules are not subject to the rules and requirements in that Federal Register and regulation that we were looking at. So under the ERISA regulations, which is a federal law that governs self-funded insurance plans that are not covered by state insurance laws, those health plans get to decide their telehealth coverage. And it may vary in terms of the scope of what they cover. The list of covered telehealth services can be plan specific. The spreadsheet we looked at for Medicare is not binding on a self-insured health plan that's covered under federal ERISA rules. And Jennifer, if you see a follow-up question on that, just jump in and let me know, because that's a great question.
Yeah, of course, I will.
So I looked at the COVID-19 flexibilities and some provisions that came about with respect to telehealth in the state of Kansas as part of the COVID-19 public health emergency. But then this gives us resources on statutes and regulations under state law or state administrative regulations and rules relating to telehealth outside of Medicaid, outside of the Medicare program, but these may be rules for general commercial insurance plans. So Jennifer, that could be our third-party administrators, our plans that are governed by state insurance laws rather than federal ERISA laws may have to follow these rules and requirements. This is where we can also find across the states information on service parity, meaning health plans have to cover services in a telehealth format the same way that they would cover them in an in-person format, and payment parity, which is paying them at the same rate, not just saying, yes, we will cover them, but we will also then pay them at the same rate. So you can find information on Kansas, Missouri, Oklahoma, or any other state if they have service and payment parity statutes and regulations. This is a great place to track down exactly where you can find that rule or requirement. Where I have used this is not only to answer questions about whether service and payment parity exist in a state, but also to help in kind of payer disputes or a policy that a payer may roll out that looks like it might impact service parity or payment parity in a state where a provider is located. And by referencing these statutes and regulations, it may prompt a question back to the payer to say, hey, this looks like in our state that might not be allowed, or how would it apply in the state of Kansas or Missouri, et cetera. They have a section dedicated to Medicaid rules and requirements in each state. And again, this is, we would do our research by going to the Medicaid program and pulling up the manuals and pulling up the policies. They do a fantastic job of keeping this pretty darn current, but it's a fantastic way to just give you an insight into some of the high level topics to think about, like the form and format, like consent requirements, how do we handle out-of-state providers, and so on. Now, professional requirements, this is talking about the licensing rules in each state. Also, I think incredibly helpful where this has changed so much during the public health emergency, and states have left off in various levels of interstate licensing compacts. We did a session on that with Diane Belquist that if you've got providers rendering care in multiple states, you may want to go back to HTRC's website and review that session. When a provider needs to be licensed in a particular state, like when do they need to be licensed in Kansas to provide telehealth services? And just how all of the licensing requirements work. They've been progressively adding more and more types of licensure rules. So traditionally, this had touched primarily on physician licensure. Now, as you can see, if there are rules and requirements for different types of professionals or facility types like a home health agency, the Center for Connected Health Policy has been adding those statutes and those regulations as well. And adding sections for, if there are any, FQHC, RHC specific details. So I'm going to flip over and just show you the similar page. This is the Missouri specific page. All I did was go to state and select the state of Missouri to get this page. You can see they've got the same categories of information, but they're going to have the updated references to Missouri's statute or Missouri's regulation or Missouri's Medicaid policy document for each of those different categories. And we can do the same thing for Oklahoma. Again, I just went to state, select Oklahoma, and you'll see the same categories, just updated references so you can refer to the state's specific statute, regulation, or payer policy. So now I'm going to go to our state specific policies. I'm going to jump over to the state of Kansas. Now, the state of Kansas Medicaid program has revamped its website. I'm trying to think when it was updated, within the last several months. And if you have tried to go out and search online and find the Kansas Medical Assistance Program, provider manuals or policies and procedures, it's really difficult just to go through a search engine and find these new references. So I have bookmarked this one because I'm on it so much and it's so hard to just Google and find. You may want to do the same if you're in the state of Kansas or you're involved with the KMAP program at all. This is the main page that's going to take you to kind of the provider site for the KMAP program. And on this new provider site, if you hover over the word provider, you can go to provider publications, provider documents. This publications tab is the one that I find to be the most useful, the one that I am in the most. This is where the provider manuals, any forms, any provider bulletins would be published. So I'm going to start by looking at the publications and going to the provider manual tab. And under the provider manual, you select this drop down, and based on the service type or the provider, you can select the provider, and you have historical provider manuals based on their date of revision. So if you're trying to look and see what was in effect last year, maybe you've got a post-payment audit or something that you're looking at, you would pull up previous versions, or you could look at the current version. And within those documents, you can do a keyword search for like telehealth or telemedicine and find the entries that are specific to that topic. I'm going to go back to the main page here. You can also search the KMAP website, but I want to show you a trick to doing this. If I search, I saw they're using the term telemedicine instead of telehealth. If you search for telemedicine, when you scroll down, you're going to see things that have nothing to do with the Kansas Medicaid program, Medicare websites. So if you go to the top, when I searched, right now it has all selected. So this is almost like a mini Google. It's searching the entire internet for that keyword search. If you toggle to KMAP instead, it will then search only the KMAP documents and resources that have that term in it. Or you could filter it to documents if you're wanting to search documents. So now you can see a lot of provider bulletins, updated policies that involve telemedicine by searching there. So that's really the key. If you're wanting to find Medicaid specific, make sure you toggle off of all onto either a KMAP page or document search. Okay, so we looked at manuals. Then I wanted to go to the bulletins. This is under publications, and I selected provider bulletins. You could search by telehealth, or you could search by telemedicine. There, you can see when we were in the manual, they were using the term telemedicine. In some of these documents, they're using telehealth. So you may need to search for both when you're looking for a particular policy, because KMAP hasn't been using that term terribly consistently. You can see we've got a new policy that came out in on February 24th, allowing lactation counseling via telemedicine. So we could pull up that provider bulletin and see the provisions of coverage. It tells us how to bill for it. It tells us the place of service to use for that newly covered service. The other thing that is interesting, after that 2023, look at these dates. Really, nothing has changed. Not much has changed since very early on in the public health emergency. And these are going in, I believe, descending order based on date. So that was the biggest bulletin change. The rest of these continue at this time, continue to say until rescinded. And we haven't had any update to indicate that they have been rescinded at this time. So now I'll switch over to the Missouri Medicaid, Missouri Health Net, and their main provider page. And you'll see similar types of documents, right? Provider bulletins and hot tips and manuals. So I'm going to open up a couple of these in new tabs really quickly. And we'll go to provider bulletins, also listed in descending order. So you can search by keyword. Okay, so our most recent bulletin update was in July of last year. Oh, good, a rate increase. Not very often we get one of those from Medicaid. So our originating sites are going to were paid a little bit more money effective July 1st of last year. And let's see how far down they go, down to 2021. Before, you would have to go to the archive bulletin. So on this main page, this is only showing the last year or two. If you wanted to search by topic, you could go to topic and search for telehealth. Let's see, 18 different options when we can find bulletins and policies. Or you could go to the archived bulletins page. Now this one, you will see the scroll bars a lot smaller because it goes down to a lot more historical bulletins all the way back to 2003. So if we were to do a keyword search for telehealth here, we're going to be able to see a lot older documents and the evolution of those payment policies historically. So that's our bulletin page for Missouri Medicaid. The hot tips page, this was where earlier in, I'm losing track of my years, I want to say 2022, when Missouri's state emergency declaration was allowed to expire December 31st of the previous year. This is where the agency came in and gave us an update on how they were going to handle changes to telehealth at that time. That's probably going to be on an older hot tips page. Looks like we have some updates February 1st of 23, but on updates for telehealth, the partnership between the Missouri Telehealth Network and Missouri Health Net. And we can take a survey. Let me go back to 2022 hot tips over on the right will take us to previous years. There we go, telemedicine, here to stay. And you can search for all of the previous year's hot tips over here on whoops, on the right by year, or we can do something similar by going to the telehealth topic index and doing a keyword search for telehealth as well. You can see there's that telehealth here to stay that we already looked at. There was an update a little bit earlier in the year. This will show all of those previous years' telehealth hot tips. And then the provider manuals page. So you can go into the provider manuals. And this is another one that says physician, but this is for the most part professional billing. This may be APPs, nurse practitioners, physician assistants as well. See if I type in telemedicine instead of telehealth. There we go. So we have a whole section in the manual on telemedicine services for Missouri Medicaid as well. What you have to, the eligible provider requirements, how they get paid, documentation expectations. All great resources to go to if you're doing telehealth for Missouri Medicaid. So Oklahoma, I think I always pick on you and put you last, but we're going to switch over to the Oklahoma Medicaid, the Oklahoma Healthcare Authority website and their telehealth homepage that tells us some of the basic requirements for telehealth to be covered under the Oklahoma telehealth program, or excuse me, Medicaid program as a telehealth service. And they've got some tools and links, but the policy link takes us to the state regulation defining telehealth services. So some of the same definitions that we saw from like HHS and how they define store and forward technology, how they define telehealth services, actually adding remote patient monitoring specifically as a telehealth service that's covered in Oklahoma, and all of the rules and requirements, all the way down to the modality, audio and video, but also consent requirements and how those work in the state of Oklahoma. That second resource link, let me go back to our main page. I just clicked on the policy link here that takes us to the regulation for the state of Oklahoma. This first link takes us here, explaining what some of the expanded flexibilities were in the state of Oklahoma specific to the COVID-19 public health emergency. So review this if you're in the state of Oklahoma to understand what might be changing as the federal public health emergency winds down effective May 12th, and how that may impact the telehealth services that you're providing in the state of Oklahoma. Oh, and that was just my 2022 list of telehealth services. So let me pause there. I'm going to come back to my slides and see if I missed any important resources for you, and see if you've got any questions in the chat that I can help answer about resources for telehealth, where to go, where would I find a particular reference material that you may look for in your own telehealth services.
We did have a additional quick question from the original question that Jennifer posed earlier.
Sure.
Commenter says that it was very helpful regarding the self-insured. When we have a minute, can we clarify this for fully insured plans as well, or is that state regulated specifically?
Yep, that's a great question. So the self-insured plans are typically going to be governed by federal ERISA regulations. If it's fully insured, those are typically governed by state insurance regulations. So let me come back to my website here. And when it comes to state insurance regulations, this is a great place to start. The Center for Connected Health, and in particular, our professional requirements. That's licensing requirements for professionals in the state, and then private payer rules in the state. So coverage parity, service parity, those types of things in the state. If a fully insured plan is a licensed insurance plan in the state of Kansas, same thing in Missouri, same thing in Oklahoma, then they would have to follow the state insurance law. Now, let me come over here to my search engine, and Kansas Department of Insurance. This is where you can find information about not only the insurance companies that are licensed to do business in the state, you know, your major payers, Aetna, Blue Cross, Cigna, Humana, United Healthcare, but also smaller companies and networks that may be providing services, as well as third-party administrators who may be administering health plan benefits for other insurance plans, can be found here. And this is going to have information on what's governed under the state insurance laws, what types of health plans specifically. So you may see on this page, or you would see on this page, it excludes workers' compensation, which is governed by the Department of Labor. It excludes fully self-funded plans that are governed by federal ERISA laws. It would exclude the Medicare program, which is governed by federal Medicare laws. But things for fully insured plans that do fall under state insurance laws, this is a great resource for prompt payment and some of those other state insurance rules and requirements that can be a resource, as well as a possible enforcement mechanism if it looks like a payer may not be following the service parity or the payment parity rules and requirements. You're going to and I'm looking at the Kansas Department of Insurance. You can do the same thing for the state of Missouri and the state of Oklahoma as well.
So if it's helpful as a quick recap and going through the slides, the National Center for Telehealth Policy, the Connected Health Policy Center, that is going to have more, that'll have your federal level resources, state level resources, and then there's links embedded within that website that can attach you to the state level statutes and things that apply to where they found that information. For KMAP, Missouri HealthNet, and Oklahoma, those were the final reviews that Rochelle did. Those were for Medicaid. Is that correct, Rochelle?
That's right.
That's correct. And then we have the resources that look at regulation, and then also some additional resources related to insurance providers within the states. That's also helpful. So keeping in mind that we will be sending this out so that you can get into those links and you can start looking for that information that is state or practice relevant to your organization.
Thank you, Molly. And what I didn't illustrate when I was going through the Center for Connected Health Policy on your state specific rules and requirements, if it's referencing a statute and has a hyperlink, it will take you to the state legislature page that has that statute listed so that you can read all of the contents there yourself. And I encourage you to do that. This is a great starting point that says, oh, there might be something there. But go in and read the actual statute or regulation yourself to make sure it applies to you the way they're sort of summarizing it on the CCHP website, right? So you need to read the actual statute or regulation to get the full terms and conditions to understand how it might affect your services.
And then the one resource that we have been asked about in the past is the one that Rochelle downloaded in the Excel spreadsheet that looks at the physician fee schedule, that you're able to see codes, the status of it, and you know, what's covered. We do have questions on more complex coverage at times, so please feel free to send that to us as well if you start going through this and realize that there are times there may not be a clear answer, but we are able to help work through some of this information because there is a lot of it. Rochelle, when does this new, I think the new physician fee schedule did come out recently, correct?
That's right. So it was finalized back in November. It took effect January 1st of 2023. So there's a spreadsheet for each year, and the 2023 fee schedule is available. I'll pull that up while we're talking and maybe looking at some questions. I look at 2023 to see the list of codes, but I've been going back a year because of this helpful guide on what's temporary, what can be audio only. For some reason, they took that out in this updated 2023 fee schedule. So I'll pull this up and open that 2023 spreadsheet for you so you can see it. There we go. See, they still have the audio only, but I really liked this column. What's temporary, what's available through December 31st. I'm not sure why they took that out this year. So that's why I've been using the old one to help with some of those dates in that timeline.
That makes sense to have both sort of open so you can see what the status is related to each of those codes.
Yes, and I would encourage you, there's so many pieces to the coverage of telehealth. Don't use any one of these resources in isolation. For example, if I'm looking at this 2023 list and I come down to where we would have speech services, speech therapy, occupational therapy, physical therapy, those codes may be on the list of covered telehealth services, but for after a period of time, PT, OT, and speech therapy may no longer be eligible distance site providers of telehealth services. The code may be on here in case you have a physical medicine or rehab physician providing those services via telehealth. So just because the code is on the list doesn't mean you've met all of the coverage requirements to be able to deliver and be paid for that service as a telehealth service. And emphasizing again, based on the first question that Jennifer brought, this is a Medicare list of covered telehealth services. If you're looking at private payers, if you're looking at the Medicaid programs, you need to go to those payer policies or that Medicaid program's policies and their bulletins to understand what they cover. And they may have different coding requirements than what you see for Medicare.
Thank you, Rochelle. I don't see any additional questions in the chat. Did anybody have any additional questions for Rochelle? I don't see anything. Remember, we will be sending out the PowerPoint slide along with the link to the video. And we encourage you to use those links within the PowerPoint to just kind of play around and get used to going between each one of those resources and downloading the Excel spreadsheets. I think we have some good tips and tricks from Rochelle in terms of not using these resources in isolation, but also pulling up both the 2022 and 2023 fee schedules so that you can see the status of those codes in terms of the PHE. Our next webinar is going to be held on April 4th. Please look in your inbox for the topic. We're still working on that. We have a lot going on. And as we know, the public health emergency flexibilities are ending in May. So we will be working with Rochelle to see what would best fit that webinar topic. If you have any questions for HTRC or Rochelle, you can email us at htrc@kumc.edu, as Jennifer put into the chat box. And please check out our website. We have updated our YouTube page, so there's a lot of education series, archived webinars that are very relevant for today as well. So please check that out. And we look forward to seeing you April 4th.
Thanks, Molly.
Thank you.